Hello, everyone, and welcome to Your Health in Your Hands, another episode of. I'm Dr. David Ajibade with the Brain and Body Foundation. I hope you are staying safe and staying healthy, and I hope you are applying the things that we are talking about or we have been talking about these last few years. It's been a privilege to be able to serve in this capacity. As you know, we have been authorized and deputized by the federal government of Nigeria, indeed mandated by the government to educate you all on health principles, the things that you need to know as Black people, the things that you need to know as Nigerians to be able to take control of our health. And from what we've seen, there are several gaps. And I'm not saying this to be nasty. I'm just saying this because this is what we found out. And the research bears it to be true that many times we tend to be careless. We tend not to look at to take care of our health like we should. We tend to do things that we otherwise should not be doing, and we end up paying for these things later on as we age. Of all the things that we try to emphasize the most is what you put in your mouth. And I got to say this because this is something that it affects everybody. Everybody has to eat. Everybody drinks something. And sometimes we think that what we're doing is the right thing, not realizing that it is actually not the right thing and it's actually costing us. So we'd like to throw around a few tips. Our guest today, I'm going to introduce him in a few minutes, but our guest today will also talk to us some more about some specific areas of food and diet. Okay? Now, let me throw out a few things. As you grow older, past the age of 30, you want to start reducing the amount of fried foods you take. Why? Because fried foods tend to raise inflammation in the body. And you've heard us talk about inflammation a lot. You want to begin to reduce your intake of salty foods because as Black people in particular, we tend to not to handle salt as well as white people do. And of course, you know, when we talk about Black people, we also talk about vitamin D. So you want to take vitamin D. The thing is, the vitamin D is that you can't take vitamin D as much from foods. You've got to take it from the sunlight. That means you have to be out in the sun. If you can't be out in the sun every day, then you have to take it in supplements. Absolutely, you need to do that, especially if you are a pregnant person. So some of the things that I found out too is raw vegetables. You want to take more raw vegetables. You want to take more fruits. Sweet potato is of particular interest to me because it's cheap and it's easily available in the market. And when I was in Nigeria, I'm visiting the US now. I take a lot of sweet potato, and that's one of the best things you can put in your body. Why? Because it's amongst the things it has fiber and it has other nutrients. So we're going to, Dr. Sodipo and I are going to be talking about some of the other areas that we think that as Nigerians you should be familiar with. And who's Dr. Sodipo, you might ask? He's a consultant family physician and HOD family medicine. He is at the Lagos State University Teaching Hospital, Ikeja. That's LASUTH Ikeja. And he is very, very interested in diet and health and lifestyle. So, Doc, welcome to the show, sir. You're welcome to the show, Doctor.
Thank you. Thank you for having me. It's a great opportunity for me.
I appreciate your making the time. And I know you're very busy and you see a lot of cases of what we shall term lifestyle medicine. So let's just, if you don't mind, let's just shoot the breeze a little bit. Let's hear some of the things that you think are important for us Nigerians to know about.
Okay, thank you. What you mentioned some of them. For example, reducing fried foods, ensuring that people don't eat so late at night. I think one problem we have here in Nigeria is most of our meals are at night. The heavy calorie meals, those with the high glycemic index, our pounded yams, our eba, those kind of foods. We like to take them at night, and of course that leads to a lot of weight gain. And of course, you also mentioned that we need to reduce our salt intake, which is very, very important. And one other thing that I think we are now doing a lot more is a lot of alcohol consumption. So alcohol consumption too is something that people need to really cut down on. We like to jaye a lot of parties. So, we need to cut down on that. So I think those are some of the advice that, we normally give our patients when they come to the clinic. And of course, carbohydrates, one of our staple foods too is rice. So a lot of us are on rice in the morning, rice in the afternoon, rice in the night, or maybe some rice in the morning, some eba in the afternoon, and something like that in the night. So we need to cut down on some of those things because over time they build up, they lead to weight gain, and of course that predisposes us to non-communicable diseases like diabetes, hypertension.
I'm sure in your practice you see a lot of yes. those things. Now, I'd like to just, if you don't mind, just give us an overview, because one thing I want to point out, Doc, we are very good at pointing out what people should not eat. We're not as good as giving them alternatives, because I think we just leave them wondering, okay, if I can't do this, this, and this, and this, then what can I do? So I'm hoping that as we talk some more, we might be able to handle specifics. But let's start with, before the break, let's just talk a little bit about you and the kind of practice you do and the kind of patients, so people in Nigeria can get a better picture of why you're interested in this field.
Okay, so I'm a family physician and I work at LASUT, that's Lagos State University Teaching Hospital, and have special interest actually in diabetes, hypertension, and of course that involves a lot of lifestyle choices that people need to make. And of course, we're seeing that the number of patients with these non-communicable diseases is increasing. So we run a clinic at LASUT where we see primary care diabetic patients. We also have a lifestyle medicine clinic, which is also run by another consultant. So it's picking up, and a lot of people are becoming more and more interested in, what are the lifestyle choices they could make while trying to keep also their quality of life. Because, as you mentioned, there's always a long list of what should not be done. And sometimes, especially in Nigeria, where we have problems with food security and food choices, it seems as if all the good food choices are a little bit expensive. So people get a little bit worried that what can I really take, that would get me living my normal life while I manage or prevent some of these diseases I've just talked about. Yes.
Love it. And then diabetes, hypertension, they're exploding all over the world, not just in Nigeria, but all over the world, especially in the US. So it's very important that people understand the pros and cons and the risks and the benefits and what they can do. So at this point, we're going to take a quick break, and please do not go away, folks. We will be right back.
The vaccine offers hope for a safe country free of coronavirus. I urge all state governments, traditional and religious leaders to take the lead in the mobilization effort within their environment and spheres of influence. I similarly urge all eligible Nigerians to present themselves and be vaccinated in accordance with the order of priority already mapped out at the various authorized designated centers only.
Hello, everyone, and welcome back. I'm here with Dr. Oluwajimi Sodipo, and who is the HOD Family Medicine at LASUT. We've been told over and over and over again that breakfast is the most important meal of the day. And of course, if you're in Nigeria, you cannot have breakfast without having bread, some sort of bread. Maybe cereal, but bread is usually a big part of the meal, and maybe yam, I don't know. And when it comes to breads, we're always putting something on top of it, usually some kind of spread. So we want to talk about some of the spreads that are available, the pros and the cons, and let's have your thoughts, Doc.
Thank you. I mean, you've mentioned it. A lot of us take bread in the morning as our breakfast, and the question comes to mind that what spread can we use? And I know we have different options. We have our butter, we have our margarine. We could also have some mayonnaise as some of the options that are there for us to take spread. So again, people tend to wonder which one should I go with? I mean, which one is actually good for my health? And I mean, what are the constitutional plays when I'm taking it? So actually, it's been a topical issue. And a lot of research has been carried out both ways. But what I would just say is that, for example, comparing our margarine, which is very, very common and which is widespread. I mean, growing up, we all grew up with margarine. with all the advertisements, and so everybody is used to that. And then probably try and compare with something like mayonnaise. So what we try to look at with our spreads is that a lot of our spreads contain fats. And so we need to look at the kind of fats that are in our spreads to be able to make a choice. And so I'm just going to try and compare maybe margarine and mayonnaise, which are some of the two common options that we have here in Nigeria. So for the margarine, the problem that we have with margarine is margarine tends to have a lot of saturated fats. And, you know, we have different types of fats, but generally we group them as saturated, unsaturated, and you know, the trans fatty acids. But I'm not trying to give a lecture here, so I'll just break it down that for those that are, you know, taking the saturated fats, those contain a lot of bad cholesterol, and the unsaturated fats have less of the bad cholesterol and more of the good cholesterol. So, so the margarine actually contains a lot of saturated fat, which contains the bad cholesterol, and the challenge with that is that over time it increases the chances of cardiovascular problems, you know, blocking the arteries, so ischemic heart disease. People put on weight, so it's a problem. Okay, so margarine has a lot of saturated fats, and specifically like palm oil. And part of the challenges that we have with that is it tends to increase the amount of bad fat, that is bad cholesterol, that is in the body. So people tend to be predisposed to having cardiovascular diseases. It tends to block up the arteries, so people have challenges with, you know, worsening hypertension, and being predisposed to is not as good as it should be. Another challenge with that is that it also makes people put on weight, and we know that with people putting on more weight, one of the things that it leads to is, you know, predisposing people to pre-diabetes and subsequently diabetes, including, you know, other challenges that come in with weight, like arthritis and things like that. Now, with our mayonnaise, it contains the unsaturated fats, and in addition to that, you also have eggs. So with the unsaturated fats, we have a lot of soya beans, and soya beans has been seen to be a good option in terms of lowering, you know, bad cholesterol. It also has some advantages with things like the skin, you know, having for those that have dry skin and bad skin, sometimes it helps a little bit with that, and of course with bone health. But with eggs, especially for people that are growing up, you know, for us as a family medicine department, we have a wide spectrum of patients. We say from cradle to grave. So we have the adolescent patients, we have the youths, and of course going into the elderly. So some of the things that we also look at there is that with eggs, of course, it helps with brain health because we all need that to grow. It also helps with, you know, muscle bulk. I can remember they used to talk about Yorubas not taking eggs as children so that they don't steal. And of course, we always had children looking very funny. So the eggs are there, so that helps a little bit. And of course, it also helps with bone health, and it also helps with the skin also. So, and the good thing about eggs too is that it also helps with the immune system. So if I was to look at the spread, I would probably want to go with mayonnaise because of some of the advantages that I just highlighted, you know, as against probably going with your margarine, which contains a lot of, you know, saturated fats, which of course, as I said, clog up the arteries. And of course, even butter too has unsaturated fats. And some challenge too that we have with butter is that sometimes there's a lot of salt, though we started having some low salt options, but that could also, you know, increase the blood pressure of our patients. So that is what I would advise going into the issue of spreads.
Interesting. So you've thrown a lot of things out there that are quite interesting. So we know that saturated fats are not good. Unsaturated fats are better. So mayonnaise has more of the unsaturated fats.
Yes.
It also has eggs. It also has, what else again?
The soya beans, the soya beans oil, which is like the unsaturated fat component.
The unsaturated fats. And these are less toxic to the blood vessels. Yes. Or less damaging to the blood vessels. Yeah. Because folks, make no mistake about it, folks. The blood vessels, you've got to pay attention to your blood vessels. And anything that damages or causes deposition of anything in the inner lining of your blood vessels is not good for you. So my ears are always pricking to see, okay, how does this affect the blood vessels? Tell us a little bit about that, Doc. Especially, I mean, I'm assuming that you actually monitor these things and you see people coming back and you ask them, do you ask them about their diet and whether or not they take a lot of all these other saturated, unsaturated trans fats and all that? How does that translate to what you see in the clinic?
Yeah, so there's a concept that we call atherosclerosis, and atherosclerosis is a situation where there are inflammatory changes going on in the blood vessels due to the fact that the constituents or the bad cholesterol that is there activates a lot of the pro-inflammatory agents that are there in the blood vessels. And of course, I always look at the blood vessel as a pipe. So for example, once you have the bad or the saturated fats in the blood vessels, what they do is that they block them. So you need more pressure to be able to overcome that blockage that is there. And the challenge with that, of course, is that when you have very small blood vessels, and that's why people tend to have things like heart attacks, they have very small blood vessels. There's nowhere for the blood to pass through. So people tend to have those challenges. The other thing too is that with the good cholesterol, which is seen in unsaturated fats, you have a lot of the fats going from the heart to the liver. So by the time they go from the heart to the liver, you know, they are metabolized at the liver, at the level of the liver. And of course, that prevents the clogging up of the arteries that I talked about, which are some of the problems that we see in people having, atherosclerosis and ischemic heart disease. So it's something that we take very seriously. Though I need to mention at this point that one thing that we always advise, which, you know, we always tell everybody is that even whatever you're going to take, you also need to take it in moderation, because whatever spread you're going to use, you need to use it in moderation. And so even if you're going to use your mayonnaise, which as I've said is a better spread in terms of the fact that it contains the unsaturated, fatty acids, the unsaturated fats, which is actually what we advise to go more with. Of course, you also need to take that in moderation.
Makes sense. Makes sense. All right, Doc, we're going to take a quick break now, and we'll be back shortly. Folks, do not go away. See you soon.
This vaccine is safe, and it has been certified safe and usable by NAFTA.
All right, welcome back, folks. I'm here with Dr. Sodipo, and we're talking about spreads for your breads. And there's, like I said, there's a lot to unpack here, a lot. But the key thing, folks, is that we're talking about the kind of good fats, quote unquote, good fats and bad fats, and how they can affect your body, specifically the lining of your blood vessels. Very, very, very important. And we Black people are much more prone to heart disease and heart attacks than Oyinbos or white people are. So we have to pay attention to such information, and we have a lot to unpack. But we're out of time. I'm sure Dr. Sodipo will be coming back more for more discussions. So, Doc, let's wrap this. Let's put this in a nice, tidy bow.
Thank you. Thank you, Doc. So, I think what we just need to take home is we need to know that there are two types of fats, basically: the saturated fats, which are the bad fats, and of course, the unsaturated fats, which are the good fats. And of course, in trying to moderate our diet and trying to have a healthy lifestyle, we also need to look at the choices that we have, that will also look at our quality of life. So in Nigeria, we take a lot of bread. Of course, we also advise that we don't take too much of a high calorie bread. So probably wheat bread. And when we're trying to use spreads, I would want to go with a spread that has an unsaturated fat, something like mayonnaise, compared against those that have the saturated fats that have a high level of bad cholesterol, like your butter or your margarine. But in general, as I always advise my patients, in everything we do, try to adopt a healthy lifestyle. And of course, moderation is key. No matter what you're doing, even if you're doing exercise, even if you're taking vegetables, even if you're taking water, the most important thing is moderation is key. And of course, try to adopt a healthy lifestyle as we eat. Thank you.
Awesome. Thank you very much, Doc. Definitely we need to hear more from you. And as I've always said, I always like to see, okay, how is this playing out in the clinic? Are you seeing the difference? Once patients come in and you find out that they're disobeying a lot of the rules of a healthy lifestyle, and you correct those challenges, and of course with your medication and the medical treatment, are you seeing a difference? Are you seeing a turnaround? These are things that we have to make as practical as possible for the layperson, for the man on the street. We can't be throwing out all this esoteric stuff, because we want to help them change their habits and their lifestyles. So I thank you for breaking it down the way you should. Now that you've told me that mayonnaise is safe, I'll feel a lot more comfortable about putting mayonnaise on my bread and my butter, and of course my salad as well. So we really appreciate you taking the time to do this. Thank you very much. I appreciate it. And folks, you can always go to our website, brainandbodyfoundation.org, and you can watch a lot of these videos. They are all archived there, as well as on the NTA website, YouTube site as well. So as Doctor said, we have a lot of great content. So please take advantage of this. They are free for you. They're done for you. As I said before, we have been mandated by the federal government to provide this education for you. So take advantage of this. In the meantime, God bless, stay safe, and we'll see you next week.